morning, everyone. This is Dr. Katie Woodley with the Natural Pet Doctor. This is our weekly COVID critters and coffee. So we are in May, so May 9th, Saturday, May 9th, 2020. And today we're going to touch a little bit about COVID, but we're also going to talk about food allergies. Why is that important to know? What are food allergies and why do we need to know about this for our pets? So let's get started. I want all of you here to make sure you comment below. I'd love to hear where you're from, what questions you have, of course. We want to make sure we go through all of that and get all your questions answered relating to food allergies, maybe cancer, other things. We'll get through those. So comment below, say hey, I'll shout you out, and I'd love to hear from you guys so we can make this as valuable as possible. So COVID, as we know, things are starting to open back up. We are doing more house consultations. So one of the things that, hey Joe, thanks for jumping on. So one of the things we want to be aware of as we're going back in and we're taking our pets back into the clinic. So if you're going to vet clinics, so what you've probably noticed is that things are a bit different, right? They're not normal. You're doing curbside drop-offs. It's very different. And so that's to protect you, that's to protect your pets. So that's why veterinarians are doing that. A lot of vets are going to be emailing you in the next few weeks, if they already haven't, about changes and like the differences and what they're doing to protect your pet and protect you, and why there's such that social distancing. And it's because COVID, coronavirus, it's still here. It can still infect people. It can still make you sick. So as we go through these phases of opening back up clinics, that's something to be aware of. Now for me, where I do house consultations and phone consults obviously are very safe, not going to cause any harm with those. So we can still help pets at a distance with that. So that's great. Now with house consultations, the biggest thing is making sure that you're wearing a mask. So I wear my N95 mask, protective gear, washing, alcohol, everything in between appointments, change clothing, shower when I get home, like all sorts of things. However, remember, you need to protect yourself too. So I require clients to wear masks, and yes, it sucks. I hate wearing a mask and you can't see your smile and I can't see people's faces, and it's very, very different. I'm finding a lot of the pets aren't worried about it, and I think they've gotten used to probably seeing us in a mask, and so they'll just kiss like the masks and stuff, and I spray that down afterwards, and change masks so that we're not creating any issues. But remember that, like, you still want to, even if people are coming into your house, you know, if it's a nice day, do the exam, do the acupuncture outside in the yard. So we're keeping everyone safe and healthy. So we're not contributing to the spread of corona. Because as we know, dogs don't tend to become infected with it. They can contract it. They can test positive for it, but they don't typically show symptoms of coronavirus. Whereas cats, they can get sick from it. They have their own coronaviruses already. So feline infectious peritonitis is a specific cat virus that makes them really sick, and they usually die from it. Coronavirus, the COVID-19, different strain. There's different strains of these viruses. So when we're talking about coronavirus, yes, it's like a generic general term. However, there's different strains and they do different things. And guess what viruses do? They mutate. And so that's the really, really hard thing about finding vaccines that work for this. They've been trying to find vaccines for feline infectious peritonitis that's caused by a coronavirus for years and years and years now. And so they're actually using that research to help develop the human side of vaccines, but it's going to take a while. It's not like you can just turn that around overnight and now we have a vaccine. So continue to practice safe measures. I know we're all craving, well, a lot of people are, some people are super happy staying at home, but we're craving like getting out, going to restaurants, being with people again, right? Is that you guys? Like, I feel like I miss like seeing people and meeting up for a coffee, or, you know, just getting together, and the weather is getting nicer, having barbecues. But remember, there's this thing that is we can't see it, and it can make people sick, and it's a reverse zoonotic disease. So what does that mean? That means that we can pass it on to our pets. And like I said, dogs don't get sick. Like as of this point, that could change. Cats can. So if you're sick yourself, make sure you're wearing a mask. Make sure you're washing food bowls and, minimizing your contact with your pet. If you're sick, you don't want to be kissing them and like holding them up to your face, especially your cats. You want to limit the contact as much as possible so that we're not potentially making our pets, especially our cats, sick. So that's my brief thing with Corona. We're all like familiar with Corona. We hear it every single day. It's all over the news. There's a lot of fear behind it. And the biggest thing I always want to leave with when we finish talking about coronavirus is, of course, if you guys have questions, post them below and I'll make sure I answer them. Now, we can do so much for our immune health. Like, are you taking care of yourself? Like, what are you doing to help your stress levels, your anxiety, your immune system? Are you sitting around just eating trash? Like tubs of ice cream every night while you're downing like tequila. I don't know. Like that's happening out there, and that's not going to help your immune system. So what are those things? Like getting those vegetables in. And this is something we're going to talk about with food allergies and our pets. Like real food, organic vegetables, real meats that are like organic, grass-fed. Yes, it's harder to find things right now. Yes, like a lot of things are out of stock in the supermarket, but we need to be feeding our immune system. We need to be optimizing our own health. So if we do come into contact with this crazy thing, maybe we just get a little sick, or maybe you don't even know you're sick and you're like, I don't know if it's allergies or if it's Corona. That's the goal, right? We don't want to have to go to the hospital. We don't want to have to be admitted. We don't want to be on a ventilator. Like no one wants that. And so what are the things we can do to start taking care of ourselves? Because I think this is a big wake-up call. It's a wake-up call for stress. Like, are we managing our stress well? Are we managing our health well? What are the things that we can change and tweak to do that? So enough of my soapbox on human health. Let's talk about food allergies. So what the heck is a food allergy or food sensitivity? I get this question all the time about pets. And especially as we're going into seasonal allergy season here in Colorado, the US in general, if you get seasons, we're entering spring. And a lot of pets are going to get itchy. And so many people go straight to food sensitivities. So the thing is that there can be environmental allergens and there can also be food sensitivities. And a food allergy, so a true allergy is like an anaphylactic reaction, right? You get stung by a bee, you swell up, true emergency, you need to go in. So it's more of like a sensitivity where our body is reacting adversely to something that it shouldn't be reacting to. And so with food allergies, what it usually comes down to is a thing called leaky gut. So leaky gut is when the GI tract lining is inflamed. And whatever reason, if it's coming into contact with, poor quality food, the pet is stressed, they're picking up on your stress. We've talked about that before. Or they've been exposed to parasites, antibiotics, other conventional drugs, flea and tick preventatives, heartworm preventatives every month. So there's all sorts of things. Roundup, GMO foods. There's all sorts of things that can affect the gut health, which is the microbiome. So the microbiome is the billions of microorganisms, the beneficial, hopefully beneficial bacteria that live in the gut. And this is where the immune health of the pet is. Like that is a lot of the research that's coming out for human and pet health. It's the gut. When we don't take care of our gut, the rest of our health falters. And so when there's this inflammation in the GI tract lining, what happens is that pet eats food. So usually like a kibble-based diet. So most pets are on kibble, maybe not on this thread, but most pets out there, they're on a kibble-based diet. And what happens is because that GI tract is leaky, so it's kind of separated. It's inflamed. So those tight junctions are not as tight as they should be. Those food particles, bacteria, toxins, they leak into the bloodstream and they cause an inflammatory response. And so what's happening is now we're getting this ramped up response. It's inappropriate. Like that's not supposed to happen. Food is not supposed to get into your bloodstream because yes, it is foreign. It should stay in your GI tract, pass through. It's broken down. We're absorbing the proteins, the nutrients, the vitamins that we need from that food. And then the rest is expelled out of the body in feces. And so if that is passing through into the bloodstream, that's setting up a whole cascade of events in your pet's body. And so that's where we can get food allergies. What are some of the symptoms of food allergies? So we may see itchy skin. A lot of times what we see is itchiness around the rectal area. So the pet's mounting an inflammatory response to that issue. And what's happening is those proteins, those food particles are passing through the GI tract. They're coming into contact with that mucosa, that skin around the rectal area, and it irritates it. And so they get really itchy. They might be scooting. They can get anal gland problems. If you have a pet that needs anal gland expression, like every 2 weeks, that's a problem. So that's not normal. Like your pet shouldn't need anal gland expression. So that can be a sign that there's something major going on, or it's minor, but it can progress to something major in the long term. Other things, especially with cats and food sensitivities. So what can happen is they get sores around their head. So if you have a cat that's just scratching its head and nonstop creating sores and lesions, that can be a food sensitivity. And so when we start seeing these signs, ear infections, that can be environmental, that can be food, that can be both. So that's where we need to work. As a veterinarian, my job is why? Why is that happening? Not what can I use to put a Band-Aid on this and just treat a symptom, right? Because that's what conventional medicine is. We're not figuring out why something's happening. We're not giving the immune system, the body, what it needs to heal itself. We don't create things that like fix the disease. What we do when we get rid of a disease is we're supporting the body enough that it heals itself. Like, can I get an amen to that? Like, we possess the abilities to heal ourselves, and so do our pets. Our bodies are amazing, and they're so powerful with being able to heal. Like when we feed it the right things, we support it the right way, we take care of ourselves, the body will heal itself. So when we go and we give it a steroid for allergies, boo, not gonna heal itself. We're not giving the body what it needs to heal itself. And I'm getting a lot of hearts. I see all of those. Like, you guys agree, I know. So what does that do? That just suppresses the body. It suppresses the immune system. It makes your pet feel better, yes, short term. But over the long term, if your pet stays on steroids, they stay Apoquel. Who's heard of Apoquel here? If your pet has allergies, it's probably been on it. And there is a place for conventional. I am not saying there's not. However, we need to make sure we're figuring out why something's happening and not just putting a Band-Aid on it to allow it to continue. Because when we suppress the symptom, we didn't fix the underlying problem. And guess what happens? The disease continues, but the pet feels good, but the disease is continuing. So it's like this double-edged sword. You're like, my pet's fine. He's not itching, but we didn't fix the problem. So they're probably eating the same food that was creating the inflammation in the first place. So food allergies. Number one, microbiome. How do we fix this leaky gut? What diet is your pet on? Kibble, not super appropriate. Some people need to feed kibble though, and that's okay. There are better brands out there for kibble diets that are going to be more biologically available and appropriate for your dog and your cat. So I have 2 cats. I talk about them now because they're our senior kitties that we just adopted. Super sweet. One has health issues and is addicted to kibble. Like, it is the thing I've preached my entire career. Get your cat off kibble. This cat's addicted to kibble. Not appropriate diet for a cat. So the thing is that we need to look at the food bag, right? Turn it around. And if we need to feed a kibble diet, what are those proteins? Is it an appropriate protein source? Is it a pea protein? That's a lot of grain-free foods. So we need to look at that and assess, okay, is this mainly a corn diet that we're feeding these pets? And if it is, it's probably GMO corn. So GMO food, the way it works is that it can be sprayed with Roundup. Who here's heard of Roundup? If you haven't, I hope you have. And it's not a good thing. And so what that does is it actually, the Roundup, what it does in the GI tract is that it actually destroys all the beneficial bacteria. So they say it doesn't harm people, but it's actually destroying all the good bacteria because they possess the enzymes that are taken out by Roundup. So those are things, it's not common knowledge. And if you have to feed a kibble diet, get your pet onto real food, organic, grass-fed vegetables, meats, eggs, sardines, real whole foods, at least 3 times a week. Now, if you're having food sensitivities, work with your vet and make sure you're identifying what are these food sensitivities so you can avoid them. There's NutriScan tests that test for food allergies. There's all sorts of food allergy tests that you can run. It's a great place to start. And then you can do either a home cooked diet, which is super easy to be able to manipulate so you know what's going into your pet. You can keep it simple diet. That way you know what's going in and you can control it. Because we can't control it if we're feeding kibble or getting food from other sources. So if we're making it ourselves, short term, you're not going to cause any harm if we're figuring out what they're sensitive to. So work with your veterinarian. If you don't have a veterinarian that believes that nutrition matters, find a new one. And go to ahvma.org and look for a holistic integrative practitioner that will work with you. That's number one. Figure out what they're sensitive to, if they're sensitive to anything. There's also environmental allergy tests that you can run that are either a blood test or a pinprick test where they're sedated with a dermatologist. They can make serums that desensitize the body while you're working on the microbiome, because remember, there's a weakness in the body to allow this to happen. And so probiotics are the foods feeding the microbiome. Are probiotics helping? Like, are they a good probiotic, or are you just feeding something that doesn't even have beneficial bacteria, or the bacteria aren't even present? So you want to see research studies that showcase that those probiotics actually have beneficial bacteria in them. So that's another thing. And then digestive enzymes. If your pet is on a kibble-based diet, get them on a digestive enzyme immediately. You need them, they need help to break down that extruded kibble and break down the fats, proteins, and carbs. So that's super, super important. The other thing would be, what are some of the other supplements? So your pet's super itchy, right? You're probably like, Dr. Katie, what the heck? My dog is scratching itself to death. What do we do? And hey, Darren, thanks for joining. So what you want to do is you can use more natural supplements that mimic the things like Benadryl, right? Everyone's like, Benadryl, try Benadryl. Why don't we use quercetin and bromelain? That is nature's Benadryl. So 10 mg per kg. Hope you guys heard that. 10 mg per kg, quercetin and bromelain. It's usually combined together, and that actually reduces the histamine response in the body. So rather than going to Benadryl, let's use something that comes from nature and is going to help benefit them, so that while you're figuring out their diet, you can start them on that. The other thing is some pets will actually respond to nettles. So Animal Essentials has a lot of these, which is great. So you can use these. So nettles will help with the allergic response. Some pets do get itchier. So I would say if you're going to start a supplement, start one at a time and space it out about 5 days, just to make sure the pet's doing well with it. but those are some good natural supplements. Is your pet getting enough omega-3 fatty acids? A lot of times inflammation gets tipped over because what happens is that their omega-6 to omega-3 ratio is out of balance. And if there's more omega-6s, what can happen is we get more inflammation. And there's a lot to that and ways to balance that. And also, we don't want to remove omega-6s because those are important for the body. So I think that's where a lot of people have issues with that. They want to just decrease omega-6s completely, but there's a ratio that you want to use. So what questions do you guys have about allergies, food allergies? Comment below. I see Darren posting a question about Adequan and arthritis. So arthritis, inflammation, right? Most of these diseases come from inflammation. You just started your golden on it. Adequan's great. Adequan is fantastic. You'd want to use it alongside other things. Like by itself, it may not be enough. So that's where making sure we're reducing inflammation through using omega-3s. Awesome. I just saw you started a salmon diet. Salmon, huge. Now, my thing I'm going to say about salmon, is it farm raised or is it wild? So you want to make sure it's wild caught, because when it's farm raised, they're fed like trash. And if you ever notice like farm raised salmon versus the wild caught, you will see, sometimes actually, you should see a different coloration in them. And the reason why is they add coloring to the farm caught because we want like bright red, right? So they add coloring to it. So, but that's great. Like fish diets, those are fantastic. Now, some pets are sensitive to fish. So that's the thing, like you need, if your pet's having GI issues, so loose stool, so like diarrhea or just softer stool, really gassy, those can be signs of a GI upset. And so they could be sensitive to white fish. That's a really common one that I see on food sensitivity tests. And so if your pet's on, let's say, not a salmon diet, but they're on a normal food and you're supplementing with fish oil, most fish oil is going to come from white fish. And so that's when you want to switch to using krill oil. And krill oil can be more sustainable too for the environment. So there's definitely different brands out there. I believe Nordic Naturals also has a krill oil brand. So you could take a look at that and transition them to that. So if you're trying all sorts of things, you know, check out NutriScan. You can order that as a pet parent and get the test results back right away. They have someone you can reach out to there, or you can work with your veterinarian or contact someone like me if you want. So those are all great things to think about. Any other questions about, let's see, food sensitivities, coronavirus, if you have questions about pets, coronavirus, immune health, cancer. So we have a cancer webinar coming up at the end of this month, and stay tuned for that. So make sure you're following us on Instagram and Facebook and everything. We're everywhere. So make sure you check that out because I'm super excited. It's going to be an 1.5-hour webinar with a live Q&A at the end. It's all about prevention, but also going to have some treatment using natural remedies and herbal medicine, holistic medicine. So stay tuned for that. All right, Darren, another question. Boy is suffering from hematomas, has had it drained twice. My gosh, hematomas are awful. So I'm so sorry that he's dealing with those. They're really hard to fix. Now the question is, why are they happening? Is he shaking his head excessively? If that's happening, he probably has an underlying sensitivity. And so that's where we need to figure out, is this a food allergy, or is this an environmental allergy, or is it a combination of both? So I would definitely take a look at that. He swims all the time. That can be a part of it. So cleaning out his ears with an ear cleaner that has lactic acid in it, that's going to dry out the ear canal afterwards, is very, very important. So that could be part of it. But normally, like when we think about how many pets, okay, so like how many pets go swimming and don't develop ear infections, there's usually an underlying reason. And you actually, Darren, you just said it. He was diagnosed with inflammatory bowel disease, or IBD. So that's huge, like microbiome. I think you jumped on a little bit after I started with like the whole microbiome talk. We have some videos that we did earlier on in the year in our Healthy Paws membership that cover nutrition and like reading pet food labels and how to boost the microbiome gut health. So you can definitely take advantage of that 2-week free trial and check those out. If you like it, stay with us and you can be a part of that cancer webinar as a part of your membership. So, but I would definitely, his microbiome would be something. What's happening is that inflammatory bowel disease is a form of leaky gut. It's a severe form. Started as mild leaky gut and then progresses. And so it's allowing those toxins, bacteria to leak into his bloodstream, and it creates inflammation. That inflammation ends up in the ears, the skin, all over the body. And that can also play a part for arthritis. So I treat a lot of IBD with herbal medicine, and it works so well when you're transitioning diet and doing all of that. There's so much we can do for IBD rather than just putting them on like steroids or immunosuppressants and feeding them. A lot of times they'll tell you to feed like the prescription diets too. And a lot of those have like corn and other ingredients that can still be reactive to that pet. I see so many pets fail those diets because they still have symptoms. And it's because it's not the most optimal diet for them. So I'm so glad you refused steroids. There's definitely more natural ways. Seeing another question. Okay, let me just move this a little, bear with me. So my dog was, here, we've got multiple screens going, so bear with me. Okay, so Mandy has a question. My dog has just been diagnosed with zinc responsive dermatosis. She is just starting conventional medicine. Is there any holistic medicine kinder to her system? Yes, Mandy. I'm sorry that your dog is just diagnosed. Quick question, is it a Husky or Arctic breed? So that disease is actually really common in Arctic breeds. And so hopefully they're getting, I imagine they're looking at diet and supplements and versus using like steroids and things like that. But there's definitely, with holistic medicine, so the way holistic medicine works, so who here has heard of like Chinese herbal medicine, is familiar with Chinese medicine in general and like the holistic approach versus conventional? So like thumbs up, heart, whatever like works for you guys while you're here. The biggest difference, yes, okay, Husky, okay, I thought so, super common. And the way holistic medicine works is we look at the whole body. Everything's connected, right? This is something I never understood with conventional. Like we're looking at these diseases and we're looking at organ systems and we're like you get it when you go to the doctor. Like you have a heart problem. I go to my cardiologist and you're like, hey doc, my knee hurts. And he's like, go see the orthopedic. And you're like, oh my God, like, no, we don't do knees. It's not related to heart. And the way I look at these pets is everything is interconnected. It's all connected. So say like gut health. So let's go back to like Darren, gut health is off. We can get ear infections. And from a conventional perspective, we would treat the ear separately from the gut. However, that gut issue is directly related to why that ear issue happened. So the goal is looking at why. Remember, going back to that why. Why did something happen? How is it all interrelated? And how do we treat that root cause? And when we do that, when we peel back, so it's like an onion. I always tell this to my clients. It's like we have a root cause and we have all these layers built up. Those layers are like the symptoms that are resulting from that root cause. So we start peeling back those layers. We start treating like the microbiome. We're treating, maybe the anxiety. We're peeling those layers back. And we might start seeing other problems, but that's all still related to that root cause. And once we finally treat that root cause, your pet achieves optimal health. That's where we don't see cancer. If they do get sick, it's really minimal. So it's like, oh, okay, like you don't have to go into the vet. Like that's huge. So it's definitely something where who here would want to spend less on vet bills? Like Finn, seriously, we spent like $30,000 on him. Like insane. Like it is expensive. Like, and I'm a vet, I get it. Like, however, preventative care, if we can keep your pets healthy from the very beginning, then we definitely want to do that versus going backwards. Saltwater Blonde. Can I purchase Sonny's Golden package? So we just did a promo with the Sonny's Golden. I will have to reach out to Tim because I'm not part of Sonny's, but I can also reach Saltwater Blonde. Send me a private message, and there's some other ways to get a 15-minute consult with me. So, what type of green should we be feeding our dogs every day to avoid cancer, like kale and spinach? Actually, let me go back to that question and just finish. I don't know if I finished with Mandy. So Mandy, definitely holistic medicine. We look at your pet specifically, and we want to make sure that we're treating that individual pet. So it's not like every pet that has zinc responsive dermatosis gets the same drug from conventional medicine, just like IBD, we go to steroids. However, when we look at your own dog with this disease process, that's where we go, okay, where are these imbalances? Where's that root cause? And it's different for every single pet. So your pet might have zinc responsive dermatosis, and this pet over here has the same disease, but you're getting two different types of herbal formulas. So send me a message, Mandy, or I can reach out to you afterwards. And if you want to go down that path, more than happy to. Types of greens, back to the cancer question. So these are going to be like feed the rainbow, right? Same for us. So we have greens, so bright greens, kale, spinach, yes, lightly steam those. It's going to help break it down. And then also you want to feed, so you can put in like red bell peppers, you can feed Brussels sprouts. Those are great. Also, broccoli is fantastic. Carrots can be really good too. So all these brightly colored vegetables, they have beta carotenes, they have more antioxidants, vitamins, and minerals. So lightly steam them so they're easier to digest, and adding those in 3 times a week or more will reduce the cancer risk by 90%. 2005, I believe that was the year, study from Purdue University showcased that. No one talks about it though. It's insane. And this was to show Scottish Terriers are prone to bladder cancer, and they fed them real food. Go figure, right? 3 times a week. And they found 90% had a reduced cancer risk. So it doesn't mean we can do everything right and cancer can still happen. So, but you can, why not try, right? I'd rather know that I tried everything. And imagine if you hadn't done that, your pet would have gotten cancer sooner. So, oh my gosh, that's awesome. You went to Purdue. So came out of Purdue University. So that's awesome. All right, Stephanie, have you ever tried Union Bayah for IBD, ulcerative colitis? I've had a lot of success with this for Nala, along with daily bovine colostrum after years of frustration with these issues. So Union Bayah is a very, it's funny because conventional doctors will use this, but still don't believe in Chinese herbal medicine. It's just the weirdest thing. However, Union Bayah is good for bleeding. So it helps with the platelet function. So platelets are necessary for clotting of the blood. And so if you're getting like bleeding from like the ulcerative colitis, IBD, there can be a time and a place for it. Now we want to use other herbs to balance it out because it can be a harsher formula long-term. So it's not something I would use by itself. It's great you're using bovine colostrum also. Colostrum's really great for helping to heal the GI tract lining. So that's great for leaky gut, along with like probiotics and other things in optimal diet. So it's awesome that you've had good success with that. That makes me really happy. I know you've done a lot for your pet, Stephanie. Okay. That was a smorgasbord of lots of random information, which I love. I love teaching you guys. So, and I love getting your questions, and I love that you're here on a Saturday morning, taking the time out to learn about how we can help optimize our pet's health. So in terms of, oh, perfect. Okay. Short-term during flare-ups, Union Bayah. Perfect. Awesome. So we are doing this every Saturday. Like, even though it says COVID, like we talk a little bit about it. And if people want to hear more, we can talk about COVID. However, the biggest goal is getting holistic medicine out there. Share this with your friends, share this with your family. We're on Instagram, we're on Facebook, we're on Zoom. Register. When you register, you're going to get a PDF guide on how to help prevent disaster, like be prepared for a disaster. That doesn't mean COVID. It can mean hurricanes, things like that, what needs to be in that first aid kit, things like that, so you're prepared. Check out our website, thenaturalpetdoctor.com. Make sure you follow us on Facebook, Instagram. We have a channel on YouTube. We have lots of free videos there, so make sure you check that out. And if you want to be a part of our membership, I'd love to have you there. Like I mentioned earlier, we have a 2-week free trial for our Healthy Paws membership. All of our videos from our monthly webinars, including our upcoming cancer webinar, go in there and you have access to them live every month. So I'd love to see you guys there. Try it out. 2-week free trial. You could watch everything and be like, nope, I'm done. And I don't care. I just want to make sure you guys have the information, the tools at your hand to help your pets thrive, avoid cancer, help them heal if they have disease, and live a vibrant, long life. So have a fantastic weekend. I appreciate all of you guys. This is Dr. Katie Woodley, the Natural Pet Doctor.
Hey pet parents, it's Dr. Katie. I hope you enjoyed this episode. If you did, can you do me 2 simple favors? Number 1, share it with someone else. And number 2, subscribe to this channel by clicking down below so you can continue to get updates every time I release new videos to help your pet thrive. Also, if you're wondering how your pet can achieve optimal health and listening to our videos made you wonder if this can work for your pet, we have an amazing membership site that can really help your pet thrive naturally by being a part of our incredible community of pet parents like yourself. Maybe you're here because you're tired of not having other options to help your pet live their best life and feel amazing. Or maybe you're here because you feel alone and figuring out how to help your pet holistically. Let's partner together today and take the worry out of caring for your pet so you have many more days to share the joy and love with them. Click the link below to grab a 2-week free trial on our Healthy Paws membership. Look forward to seeing you on the next video. Until then, remember you're not alone in helping your pet thrive naturally and live each day to their fullest potential.